Hello, everyone, and welcome to this video. Actually, in this episode, we are going to discuss the JCI accredited organizations starting the very beginning of the Joint Commission International 1999 through December 2024. It's like a business analytics report studying what kind of accreditations, what kind of certifications JCI is providing all over the world, what is the success story, what is the business opportunities or areas for improvements, what are the countries, cities, the trend all over the years of the success in implementing or establishing the healthcare quality and patient safety in the world. So let's get started. Actually, we started with a couple things here. So first of all, we decided on the variables. Actually, these are 6 variables from the JCI accredited organizations list on the website, as we are going to see in a minute, but we expanded them to like 13 variables afterwards, not only 10 variables, and we will see why this. Okay, for spotted 995 healthcare organizations in 28th of February 2025. So we excluded any accredited or certified organizations in 2025, and just we did the date range from 1999 through 2024. Definitely excluding the denial, revoked, the voluntary withdrawal. Actually, this year, I guess JCI scored them out, so it is not there. So this is the first step, they deciding on the variables and the methodology we are going to use in our data frame. And then going through the website of JCI, actually, a lot of challenges are there because it is like JavaScript web pages. So we did web scraping using Python and AI agent DeepSeek, and we separated the rows as we are gonna study one hospital here. So it is accredited and then certified with a couple of programs. So we decided to make every single observation of every single row like one complete observation, not cumulative. For example, this hospital is accredited as a hospital, okay, and then certified for primary stroke, for example. So now it is 2 separate observations to facilitate the and scrutinize the analysis, okay. So we ended up with rows bigger than the actual accredited organizations. So we will see the details of this. And then step number 3, data wrangling, cleaning, transformation using Microsoft Excel. We excluded a couple of organizations in 2025 in this date, 28th of February 2025. And unifying and cleaning city names, country names, dealing with some missing data, like for a hospital here in Riyadh, Saudi Arabia. And fourth step, data analysis and visualization using R and Tableau. And finally, conclusions and recommendations. Here from JCI website, there are 9 accreditation programs, as we can see: enterprise accreditation, academic medical center, ambulatory care, home care, hospital, laboratory, long-term care, medical transport organization, and a primary care center. And actually, academic medical center, most probably it's a hospital at the end of the day, but you know, they are providing research and education, so it is academic medical center, but finally it is a hospital. Now, for certification programs, actually there is eligibility criteria. So the organization has to be JCI accredited first, and then they can enroll into one of the clinical care program certifications. And there are a lot, and we spotted like 46 programs here in this data frame. So we went through the publicly available information on the website for the accredited list, and this is the accredited organizations list, as we can see. Okay, so we identify the variables. So we have the organization name, and is it accreditation or certification, and what's the type of the program. Here it's, for example, long-term care, and since the date, since started the accreditation, and then the location, including the country and the country and the city. So basically we have 6 So we have actually 6 variables, but at the end of the day, actually we separated them into 13 variables. So this is the website, but here there is an outlier. So we have a hospital here in Bogota, Colombia, in Latin America, that is accredited for its academic medical center hospital program. And then they have 21 certifications, which is very unique. And we will see it is like an outlier in the data. And our data frame after web scraping, this is the final results. So we have those kind of variables: the organization, the program, the year, the month in characters, in names, and the day. And this came from since. So we actually separated since to 4 different variables. Actually, nevertheless, we did them like factorial. So here, day, month, year, it is numerical variables. And then here we did it like factors in terms of enumerating them, counting them in our data analysis, and we will see this. So, and this city corrected, CR for corrected, because we've done a lot of corrections, and we are going to see. And country, some cleaning happened here. And is it accreditation or certification? Okay, so this is our data frame. This is our data frame on the software. So let's get started having a look on the insights. So our insights, so we have 26 years data frame starting 1999 through December 2024. And then we have unique 979 accredited organizations in this data frame. So it's almost 1,000 organizations all over the world. It's a success story, really. And then we have 1,104 accreditation and certification programs surveyed. So we separated the accreditations and every subsequent certification. So we end up with this number for those unique organizations. And we have 55 total programs provided in this 26 years. 9 of them are accreditations, as we saw before in the above slide. And then we spotted like 46 certification programs as well. And we will see the details of them and some insights regarding those. So JCI is operating in 71 countries, which is big. And we will discuss some business opportunities here as well. And finally, more than 340 cities all over the world in those 71 countries. So actually, it's a very compelling starting. So let's keep on. So this is data frame summary or the table summary. So we have those kind of names of organizations, and we have this hospital or university hospital in Bogota, Colombia, with 22 programs, 22. So we have 1 accreditation programs and 21 certification programs, and then 2 for 7, this cardiovascular center, and then Tawam Hospital in Al Ain, United Arab Emirates, and then 6 here, and then Al-Zahra Private Hospital, 5, Salam International Hospital, 5, Bangkok, Thailand, 5, and then Al Ain Hospital, 4, Al-Qasimi Hospital in Sharjah, Emirates, 4, and so on and so forth. So this was like an outlier, as we can see, and this is sort of a snapshot of the organizations ordered in a descending manner. So we have here the frequency of the programs, and we have the percentage of the programs out of the whole accredited organizations, and then the cumulative percentage. So actually, this hospital is very unique, very unique. It's a case study itself, okay? 1 accreditation program and then 21 certification programs. As we can see here, this Columbia University Hospital, actually we have here in JCI accreditation, like 1 program, and then 21 in orange. And we have 51 total programs. This is like descending order for them. as we can see, hospital program is still like 60% of the data frame itself, okay? And then ambulatory, which is accreditation program, and then academic medical center, which is like a hospital program as well, and then laboratory, and then home care program, and then long-term care program. So till number 6, or here, it's all accreditation programs. And then primary stroke started to appear here as a certification program, and then primary care program, back to accreditation. Acute myocardial infarction, this is certification, and then enterprise accreditation. So those are the top 10, and we have like, 8 accreditation programs and 2 certifications in this list, and the hospital is still on the top. So we have 9 accreditations in total and 46 certifications. And if we can look at this, so cumulatively, those only 4 accreditation programs, hospital, ambulatory, academic medical center, which is subsequently a hospital, and laboratory, actually counts for more than 80% of the business. So 4 programs out of 55, like 7% programs, counts for more than 80, like 82.6, all for our accreditation programs. So this is the main business actually of the Joint Commission International. And here are the details of the 55 programs. As we can see, the hospital is the star, and then here ambulatory. We have here academic medical center, which is hospitals once again, and here laboratory. And we can see a lot of certification programs here at the bottom, which is like one program surveyed for one organization, okay? And here another diagram. So in orange, it is an accreditation, and in this turquoise, we can see it is like, certification programs, okay? Now, so JCI accreditation programs cumulatively counts for like around 90% of the business, and only like 10% is certifications. So here is an area for improvement for certifications, and a lot of other accreditations. If it is a business case, definitely for JCI leadership, they can decide on this. And this is the graph for the bar chart for JCI accreditation and certification, as we can see here. Never bother about this because it is, a big chart, and we just put in here, squeezed it into the slide. So timeline of the programs here. So here at the x-axis, or the bottom here, we have the years. Okay, and then we have the 55 accreditation and certification programs here, and we can see simply that hospital program started at early the beginning, like every other accreditation body and all over the world. Actually, hospital program is the star, and subsequently academic accreditation program, which is hospital at the end of the day, started at the early beginning. So, and consistently all over the years, okay, hospital program is the star. Now, regarding the trending over the years, so we can see post-COVID acceleration happened. So starting in 22, 23, 24, actually, there is big business here, big chunks. Okay, and we can see here in the, in the chart, okay, there is a rising trend, and post-COVID acceleration actually happened. Okay, and really, it's a very nice success story, okay, all over 26 years. And actually, 1999, it's like a couple of programs or one program done in December, as we will see in another chart. So actually, the real start was like 2000, in the year 2000. And then you have here like a glitch in every business, and then there is good acceleration or trending here. And now, as we can see, every single year out of the 26, we have business running here, and these are some coordinates out of these density plot. And we can look here at the years as well. But this time we have the JCI certification programs, a chunk here. And we can see like a pattern here in 2019, just before COVID, and 2017 as well. Okay, so it's good chunk. And then another, breath here after COVID in 2021 for JCI certifications, but still the JCI accreditation is the majority. And before 2007, actually, there was no certifications here. So this is a very beneficial chart in trending and analyzing the JCI certifications against accreditation business. And if we have a look here on this violent chart, we can see that JCI accreditation, very consistent from the start, from the beginning till the end. But here, 2007, starting the, as we saw here, actually, the certifications started here. So here we can see 2007, there is the beginning for certifications. And this, bulge in the violin, because actually the number of certification programs definitely surpasses the accreditation programs number. Here in the analysis of different months, cumulatively all over the 26 years. So basically, we have good story here. And from my empirical just observation for JCI activities, actually, I can say confidently that the fourth quarter definitely is the lucky quarter for JCI visits all over the world. So the data actually confirmed this with December, November, October, the lucky fourth quarter. There is a good acceleration in terms of doing business in terms of accreditations and certifications. And we can see here, okay, there is, every month there is a big business. And here, once again, we are splitting the certifications and accreditations. So December is the star, and even the certifications cumulatively through 2007, starting of certifications till December 2024, actually, there is a big chunk here of certifications in December. Here is a violin. Sometimes it's confusing, but just have a look here. Starting this point, like 2007, okay, there is consistently starting this year, business every single month, okay? But here, at the beginning of the business, starting in 1999 till 2007, some missing months here. But starting 2007, there is sort of consistency, or even 2006, if we can plot it here. So starting 2006, actually, there is every single month, there is business. Okay, in terms of days, it might not that accurate, but it can reveal, obviously, that every single day there is a business, and we can have a look here cumulatively in the 26 years. And here's split once again for JCI certifications and accreditations. And remember, this day, it means cumulative days of the total months of the total 26 years, okay? So, you can see some patterns here in some days, okay? But, it is not seasonal, it is not cyclic, it is not, we couldn't confirm a lot of things here, but it is nice. But here in the violent chart, once again, we can say that here, like 2009, for example, we started to see everyday business, okay? Everyday business, sort of, okay, all over the cumulative, 26 years with subsequent 12 months every single year. Okay. Now I can tell that this map or this graph is one of the, I can call it the first amazing graph here in this analysis, okay? Because it has a lot of information. So we have here years, we have here months, and we have here JCI certification in turquoise, and here JCI accreditation in, in orange. And we can have a look here to 2007 here. Okay, yeah, okay. So we can tell which month was missing a business all over 26 years. Okay, so here, obviously, in this area, like 2005, there is a lot of missing months without any business, without any certifications, without any accreditations. And certifications started here. So this is 2007, we can tell, 2007, the certifications started in turquoise. Okay, and there is a missing month here, another month here. Okay, so it's very nicely put graph. And the density of the point actually reflects the number of or intensity of the visits in this month. So this is very, very amazing. So there was no consistency here in the first year, starting 1999, definitely, because here in 1999, here there is accreditation visits in only December, okay, month 12. And here till 2005, there is inconsistency of the visits and the business. And then starting 2006, started to be like a solid business. And 2007, certifications started. And here, as we go towards the millennium, actually, we have a lot of certifications, very good number of certifications. So this is a very nicely put graph by R, and it's mapping all the visits for all the years and all the months, every single year, all over 26 years, in terms of accreditation visits or certification visits. So this is the first amazing graph I can tell here in this analysis. And then we can go to city, analysis of cities. And we can see here, for example, Al-Madinah Al-Munawwara was having a couple different spelling all over the data frame. So Madinah, Al-Madinah Al-Munawwara, space Madinah, space Al, space Al-Munawwara, and here Al-Madinah, one word, Al-Munawwara, one word. Once again, different spelling, Al-Medina, Al-Munawwara. Okay, it's a very understood. However, we should unify and standardize the city names in order to make it user-friendly for data analysis or softwares we are using, and then to be standardized with the maps, like standardized map, like Google Maps, Apple Maps, in order to be better understood by any software we can use. Because I plotted them on the Power BI and it was like a disaster, actually. Okay, but R was nice, but identified, even after a lot of cleaning, identified a couple odd words in city names. However, we did a lot of cleaning and unifying, and for sure it was very nice. And we will see now a map for this. And here, for example, Mecca. Okay, okay, I'm just saying Al-Khubar, Al-Krabiya, Akrabiya. Okay, Al-Khubar. So we should decide it is Al-Khubar or this little city, and so on and so forth. So in terms of city ranking, Dubai definitely, okay, with 8% of business, more than 8%. Abu Dhabi, still we are in Emirates here, so 6% of business. So actually both like 15% of business, 15% of business, two cities only, okay, in one country. GCC country, Arab Emirates. And here, Bangkok, Thailand, okay, with a decent number, and then Riyadh, okay. And we will discuss Saudi Arabia. Moving ahead, we will have a look for the odds of Saudi Arabia. Sao Paulo, Brazil, Doha, Qatar, Sharjah, Emirates, once again, Bogota, Colombia, because of this university hospital, remember, with 1 accreditation and 21 certifications, and Istanbul, Turkey, and then align back to Emirates. So those are the top 10. As you can see, a lot of, number of accredited organizations or accreditation and certification programs. So have a look on the 22 top cities, starting with Dubai, ending with Al-Madinah Al-Munawwara in Saudi Arabia. Here, 21 from out of 341 or 6% of cities count for 50% of the programs, and 12 out of them, 11 Arab and one Arab Muslim countries. So Arab and Muslim countries cumulatively, it is like 12 over from the 22. So for, you know, cultural sensitivity things and so on and so forth. So they have decent actually business with the Arab and Islamic countries, especially Arab countries. And here, 4 out of the 12 in the United Arab Emirates, 3 in Saudi Arabia. And we will see United Arab Emirates and Saudi Arabia like the top 2 countries. We will be having a look definitely on those. Okay, so we have here cities, and definitely here we have Dubai. Okay, but it is a little bit confusing. So let's go straight to this. Another confusing, but it's map this time, but it reflects, the red dots reflects the big business of, you know, JCI all over the world in different cities, like 340 plus cities. And this is a nice city word cloud by R for the top cities. So we have Dubai, Abu Dhabi, Bangkok, and Riyadh, Sao Paulo, and then we have like some distinct or prominent other cities here: Doha, Al Ain, Dublin, Rio de Janeiro, Madrid, Istanbul, Jeddah, Sharjah, Cairo, Barcelona, Mumbai, Ajman, and so on and so forth. Okay. Now, coming to the countries, and here is a big chunk of analysis, very important, very fundamental, as we will see. So UAE and Saudi Arabia, like more than 30% of the business of JCI, and then Brazil, Thailand, India, Turkey, Colombia, Spain, Ireland, Qatar, those are the top 10s, with still UAE and KSA like the big chunk here. And if we have a look at the top of the data frame with the cumulative percentages, actually the percentage here, 80%, like 16 countries out of the 71, like less than 1/4 of the countries count for more than 80% of the business. 7 of them are Arab and Muslim countries. Top 2 counts for 32 of the total organizations, Arab and Muslim countries, UAE and Saudi Arabia. And top 5 countries, 7% count for 50% of the business here, like Emirates, Saudi Arabia, Brazil, Thailand, India. Those only 5, you know, counts for 50% of the business, which is, you know, very insightful to have a deeper look into the big business, the big chunks here, okay, to focus on. Those are the, you know, the mega accounts for JCI. And here's the bar chart for the stars: UAE, Saudi Arabia, Thailand, Brazil, India, Turkey, and so on and so forth. And here with the accreditations and certifications, and we can see that top countries as well have a good chunk of the certifications. However, in Saudi Arabia, it is sort of a little certifications, and Colombia, once again, it is an outlier with those 21 certifications for one hospital. It's big chart here, but if you have a look here, those are the years on the x-axis and y-axis representing the 71 countries. And we can see Brazil, Saudi Arabia, UAE, those 3 started since the very beginning for JCI business, okay? For Saudi Arabia and UAE, I can understand very well, okay? They are early adopters, okay? But for Brazil, there is something here I'll be delighted to know what is it. It was like a smart move to get Brazil involved, one of the prominent BRICS country involved since the beginning of the business of JCI. So there is a smart thing here we need to know. Okay, this is the second amazing graph in this analysis. So we have here the the 55 programs here on the y-axis, and x-axis the 71 countries. You can tell here that Colombia is an outlier with a lot of programs, 22 programs or more here, okay? And here, hospital program is very consistent all over the countries, okay, or most of countries, okay. And then you have this, blank areas, which is areas for improvement, or can we plot what are our priorities to plot a program here or there? But for sure, hospital program is very consistent. Colombia is very outlier, but mostly because of certifications. And here is ambulatory. We can see another trend here. And academic medical center on the top, which is, at the end of the day, it is hospital program as well. Primary stroke is very prominent, certification program. Long-term care, okay, a lot of countries don't request it, which is bizarre to me. Diabetes mellitus, even like one program surveyed, very odd to me, actually. Dialysis. So a lot of areas for improvement in this graph. So here are the countries, here are the programs, and we have this canvas to think thoroughly by the leadership or strategy, developers in JCI, what is missing here, what we should focus on, what we should, skip for now, and so on and so forth. Okay, so it's a very nicely put chart. Now, this is a map of the world, and we can see a lot of countries, 71 countries, big job, JCI. So we have here red UAE, and here is Saudi Arabia, and then Brazil. You have here India, you have here, Thailand. Okay, big business all over the world, all over different continents. But here, this is my third amazing graph, this map, because it is blank, okay? And we can see here like some blank canvas here, we can say, okay, I understand JCI is not operating within the United States because actually there is a domestic program by the Joint Commission Domestic, the mother of JCI here in the United States. So it should be blank, no problem. And good job, Latin America. Good job, Asia, especially China and India, big chunk, okay? Good job, GCC, and good job, like some of Eastern Europe here. But here, Canada, I understand there is, okay, Canada, they have Accreditation Canada, which is a very prominent organization, and it is very, unique and historic, like JCI, okay? But Accreditation Canada International may need some development, but they are very smart, actually, and they did a great job within Canada. I understand for Australia and New Zealand, they have their own commissions, okay? The Australian and New Zealand commissions for healthcare quality and safety. Okay. UK missing, okay, they have CQC as well. Okay. I understand the problem with Russia, Iran, North Korea. Okay. But have a look here to stands here. We have only Kazakhstan, I guess, and then stands here still blank. A lot of, countries in Europe, France, Germany. Okay, they have their own unique systems. However, JCI can help a lot in this. Eastern Europe, Scandinavia, starting Greenland, Iceland, Norway, Sweden, Finland. I understand Denmark, but definitely Greenland is attributed to Denmark currently. So Sweden, in particular, has its own unique system. They are integrating the quality in everyone's job. So there is no per se quality department or quality directors or quality teams. It's like it's our daily job integrated within the tasks of every single clinical and admin member in the healthcare system in Sweden, which is a very unique situation in Sweden, and hopefully we can learn a lot from it. But look at Africa as well. And with this emerging economy, like the late Professor Hans Rosling from Sweden said that the coming economy is Africa and Asia. So we should look at Africa, and we can design like, unique packages, for example, for Africa, according to the income and the status they are within now. and stands, and some other Latin countries. Still, there is a good opportunity. Okay, so but anyways, it's a good job, and they covered like one continent here, Latin America, some of the North Africa, like Egypt, and some of African countries, like four, and here GCC countries. Good job in Asia. Here, China, India, big chunks, definitely Indonesia, Thailand. Okay, good job, Malaysia, and here were Turkey and Eastern Europe and Spain, Portugal. So, okay, it's a business opportunity if you look at this nice map. Okay, I did a lot of efforts into this map and the maps in general here actually. Using R in terms of analysis. So I guess we got a lot of insights out of those charts. Now, using AI, I did this nicely put graph or photo or picture for UAE and for Saudi Arabia, because those are the top business of JCI all over the world, and in GCC countries and in the Arab world. And let's have a look on some data insights from those two countries. So Saudi Arabia in general, these are the total number of accreditations and certifications in Saudi Arabia, and this is United Arab Emirates. And I can say that Saudi Arabia was not like this before. When I first visited Saudi Arabia back in December 2012 in a business trip to CPHQ as a visiting consultant, actually JCI was like a big chunk here, like they were just behind UAE for a little bit, but now there is a big difference. Why? I can say confidently because of CPAHI, the local accreditation of Saudi Arabia, and it is mandatory for every healthcare organizations by law here in Saudi Arabia. So actually CPAHI, I guess a lot of organizations, especially under Ministry of Health, for example, gave up on the JCI to CPAHI accreditations. But still, a very good chunk of organizations and big organizations actually accredited by JCI. But here still UAE, they have a lot of accredited and certified organizations in terms of JCI. Here, if we split the certifications and the accreditation, so Saudi Arabia here, this is accreditation, and this is certifications of Saudi Arabia. And here, UAE, Emirates, we have here the chunk of accreditations, and here the chunk of certifications. So both are accelerated in UAE because it is open there. You can go for JCI, for Canada, for Australia, whatever accreditations, it's open in UAE. So they picked mostly JCI. But here in Saudi Arabia, they have mandatory CPAHI, so they retracted in terms of odds here for accreditations, okay? And even CPAHI developed lately some certifications, but it will be effect soon. Okay, here if we look at the programs, all the 55 programs, or they use the programs out of the 55 into the two countries, and they are plotted here. So Saudi Arabia have like 2, 4, 6, 8 programs here, accreditations and certifications, and a lot or a little bit more here in UAE, even if there is one certification done. Okay. And if we look here to this chart, Saudi Arabia, those are the accreditation programs in blue, and then in orange, this is certification. And we can say in UAE, actually, a lot of certifications, like 2, 4, 6, 8, 10, 12, 14, 16, 18, 20, 22, 24, 26, 28, and 4, 6, 8, 9 only accreditations, and the rest are certifications. So a lot of business for certifications here in UAE. So it is nicely put chart depicting the programs adopted by Saudi Arabia and the UAE so far, all over 26 years. And finally, we can have a look here on the cities having those kind of accreditations and certifications in both UAE and KSA, Saudi Arabia. So, to wrap up conclusions and recommendations, JCI is a success story in improving healthcare all over the world, as we can obviously see from the data insights in this report. The accreditation is the main business still, okay? And the certification is an area for improvement, and some accreditation programs as well, if it is decided by the leadership of JCI to be a business case. And sometimes some, underutilized programs, but they are like significant because it is sort of intangible benefits to the JCI or the organization. So it's left to the JCI leadership. Some countries and cities with no JCI presence may be a business opportunity as well for JCI. And thank you so much. This was me, Ahmed Yahia Bahloul, a medical doctor holding MPH from the American University of Beirut in Health Management and Policy, CPHQ, CPPS, and Lean Six Sigma Black Belt medical planning manager here. And, hospital group, major hospital group in Saudi Arabia. I'm Egyptian, by the way, and this is my email, this is my website, and this is my mobile number and WhatsApp. So thank you for watching, and hopefully you enjoyed this report and those kind of business analytics. And, I guess JCI is one of success story in accreditations all over the world. And hopefully they continue their successes, and hopefully other accrediting bodies can, surprise us with a lot of efforts towards quality and patient safety. And that's all for now. And thank you so much. Have a nice day. Thank you.